So the United States is quickly becoming the epicenter of the disease. Obviously, Western Europe continues to have very high burdens of disease. But I think what we have seen is this pandemic move from China to Western Europe, now to the United States. And I think the next few weeks in the United States is going to be very, very hard. We're going to continue seeing large increases in number of cases. I think within a week, America will end up having more cases than any other country in the world, including China. And I think we're going to start seeing a lot more deaths from the disease. But we are starting to make some progress around social distancing. And the biggest challenge remains for us having adequate testing capacity and then deploying that testing effectively so we can relax some of these social constraints and let people get back to work. I think there'll be a lot of significant challenges ahead, and it's going to be all about political leadership. I think with great political leadership, we can get through this, but otherwise it's going to be a very hard 12 to 18 months for the United States.
When do you expect that we see a better data in terms of the restriction of the cases of people affected by COVID-19 after the social distancing has been applied in our daily lives?
Right. So, right now we're still doing social distancing somewhat haphazardly. Many states are doing it, many states are not. Obviously, people travel from state to state, and so state-by-state approach is not nearly as effective. It would be much better if we were doing it nationally. Still, state-by-state does help some things, better than nothing. And we think that typically it takes 2-3 weeks for after a policy like social distancing is really put into effect for it to start having benefits. Because in the first week or two, you're still picking up infections that happened before that policy was put into place. And it takes a few weeks, 2 to 3, before you should start seeing some flattening of the curve that might come from social distancing.
And the concern that you have in regards to the global situation, particularly in Europe, how would you describe?
Yeah, so right now, Western Europe, and I mean everything from Germany, Spain, obviously Italy, UK, they're all on different parts of the trajectory. But I am very worried about all of them. Because basically, well, Italy, of course, it's awful. They have more deaths than any other country in the world. There is some evidence that the number of infections is starting to flatten, which may be a benefit of all the social distancing, especially the lockdown that they imposed. But people are still dying, and unfortunately, the number of deaths will, I think, continue for a little bit. Spain is on a very similar trajectory to Italy, with lots of deaths, lots of cases. Maybe they put in social distancing a little earlier, and so maybe they can avoid some of the worst fate. UK, to me, is the big unknown. I don't know what's going to happen there because for many, many weeks, they just didn't make any good decisions. And then finally, they went into a lockdown. But as they ramp up testing, we'll see a lot more cases in the UK, and I think, unfortunately, a lot more deaths. And then Germany has been a bit puzzling to me. They have had very few deaths. They obviously have a very good health system, but I don't know if that's it. So Germany needs a little bit more sorting out. I don't quite understand it so well. So those are some of the big Western European countries. Obviously, there are other countries, the Scandinavian countries, Netherlands, others. I've seen very little data coming out of Eastern Europe. So Eastern and Central Europe, I don't know what is happening as well. And then, of course, there is the rest of the world. The rest of the world that is not Europe, North America, and China. And I am deeply worried about what is going to happen in the rest of the world because in many, many parts of the world, things are, of course, very crowded. In many parts of the world, the health systems are not very good, are not well developed, and don't have a lot of extra capacity. And that really makes for a very, very challenging situation in terms of this virus.
So basically, from your words, I can understand that the effectiveness and the readiness of its government in a national level basically plays a huge role on how to restrict and contain this pandemic.
Yes. Go ahead.
Go ahead, sorry.
No, this disease, this global pandemic, I think It's very hard to talk about what effects it's going to have over the next 5-10 years because we're just in the early days. But I already feel like it's starting to kind of reshuffle the world order a little bit. It is telling us which governments have the capacity and capability to manage complex outbreaks like this and which governments don't. And what's been most interesting to me is a lot of the East Asian countries, the South Koreas, the Taiwans, the Singapores, even Japan, have done generally a much better job than UK, France, Germany, certainly Italy, and the United States. Who would have guessed that these kind of global powerhouses would struggle so much more than South Korea and Singapore and Taiwan? It does tell us something about governance and capacity and ability to move quickly. And I don't know what the long-term implications of that are, but they feel like there are going to be long-term implications of that from a governance point of view.
Have you monitored at all the situation right now? For example, you spoke about Spain, Italy, Germany, UK, but in particularly, for example, for Greece, do you have any recommendation or any assessment?
Yeah, it's been, so I've tried to do a little bit of digging into where things are with Greece. And mostly when I see what data is available as I can best see it, I'm mostly just worried. I'll tell you why I'm worried. Right now, they have only about 800 identified cases, about 23 deaths as of this morning. But a sense that is almost surely a vast underestimation. Vast underestimation. And the reason I say that is that I just have not found very good data on how much extensive testing there is. And my sense is there's not a lot of extensive testing. Second, when you look at the disease curve, it looks pretty flat. That doesn't make any sense. It shouldn't be flat. It should be rising the way it does in every context. And so when it just gets a little bump and then kind of stays flat, it makes me think that you're missing a lot of cases. Of course, Greece also has very specific challenges around refugee populations where things like social distancing will be very, very difficult. And so I put all that together and I say, I don't know how much testing there is, but I'm worried there's not enough. My sense is that case finding, therefore, has not been adequate. And therefore, I worry that there's a lot of community spread happening. And in a couple of weeks, we're going to see potentially an explosion of cases in Greece. Now, good news is Greece has put in some strong social distancing measures just in the last couple of days. I think that's great. I think that'll help. But of course, there are challenging populations like the refugee population that I don't know how they're going to manage.
So you think that there might be cases that has not been reported yet because there is not enough tested, or because we don't know, we don't have the clear picture right now? This is
I've tried to find data on testing. The last set of data I could find was almost from a week or 10 days ago. It might be that there's more data and I'm missing it, but I don't think so. And I think that based on how this disease has gone in every other country, my guess is there are a lot of cases in the communities in Greece that the country has not identified, and that the burden of disease is much more substantial than what is being reported. If, on the other hand, I'm wrong, and there has been massive amounts of testing and a very effective public health response, I'd love to see that data. But until I know that there have been tens of thousands of people tested and a very aggressive plan, my assumption, because this has been true everywhere else in the world, and Greece, why would Greece be different? My assumption is that there are very substantial numbers of cases that have not been identified.
And one last question, because I know your time is so restricted, and thank you very much for doing that. There is a huge skepticism about the impact that this situation will have in our daily life in the long term. Do you expect that this is a situation that we will not get it over anytime soon, that we will have to adjust our lives in a much longer term than expected?
So look, it's very hard. This is a novel virus and there's a lot we don't know. And so it's of course very hard to make predictions about the future. And there have been many by very good people Some people who worry that this is going to end up becoming a long-term problem. I see it, and I say this with a lot of caution because, again, we're early days and I could easily be wrong. But my best assessment today is that this will stay with us and change how we live for the next 12 to 18 months. So first of all, let's talk about why I picked that time frame. My hope is in that time frame we will get an effective vaccine. It is not assured that we will get an effective vaccine. We have not developed any effective vaccines for the coronavirus in the past. And so this is a novel, not only a novel virus, but we're going to have to develop a novel vaccine. And it may work or it may not. So we don't know. But let's say that I'm right, that in the 12 to 18 months, we'll have an effective vaccine that we can deploy worldwide. If we have that, the disease will come to an end, or mostly, as long as we get large numbers of people vaccinated. Second is, until that happens, the infection will continue unless in some communities you get to what's called herd immunity, very, very high levels of infection. The problem with very high levels of infection is, although we don't know an exact case fatality rate, our best guess is that 10 to 15% of people end up getting very sick, and maybe 1% of people end up dying. Those don't seem like very large numbers, but when you apply it to a full population of people, so you apply it to a population like Italy, for instance, 60 million people, let's say 45 million adults, 10 to 15% of people getting very sick means 4 or 5 million people. Health systems just become completely overwhelmed. And so we are going to have a strategy where we let this disease march out over the next 12 to 18 months without shutting down our healthcare system, without overwhelming and getting lots of doctors and nurses sick, and yet being able to go back to some semblance of normal life because we can't be shut down for 18 months. So this is going to be a very difficult balancing act. I don't think life is going to go back to normal anytime in the next 12 to 18 months, or not for any long period of time. But we could probably get a large chunk of that normal back. We can go back to work and kids can go back to school but we'll have to do it very carefully with lots of data, lots of aggressive testing and quarantining. And if we do all of that, I think we can get much of our lives back, but probably not everything until this disease comes to an end.
And probably not the same way of our lives back.
Probably not the same way back.
Thank you very much. Stay safe, be well, and thank you for contributing with your comments today.
Thank you very much for having me. It was a pleasure.